It's a creative approach to a vexing problem. Engaging African Americans using trusted relationships like faith communities to increase participation in advanced care planning.
We're going right to the root sources. We are talking to persons in their community, in their churches, in their social organizations, so that we have a better first-hand understanding of that.
An understanding of how culture and disparities impact African Americans' decisions about taking advantage of advanced care planning, palliative care, and hospice, services critical to quality end-of-life care. The Center for Practical Bioethics, with support from the John and Wanna Harmon Foundation, is leading the effort to address this persistent challenge, long ignored by many in healthcare.
They're continuing to develop initiatives to get some of those doors open and to get some of the minds open so that people can begin to trust and believe that these resources and services really can meet their needs and they really are intended for people like themselves.
This willingness to work in unconventional ways on issues that aren't getting the attention they deserve is nothing new. Since its inception, the Center has played a critical role in identifying unmet needs, anticipating emerging issues, and staying ahead of the curve in addressing the pressing healthcare issues of our day. The Center's goal?
Find where these issues resonate, to raise them, and then figure out what is the fitting response of this organization to help society grapple with this issue.
These days, technological advances from artificial intelligence to gene editing have captured the attention of Center staff, who monitor new developments and respond when ethical considerations arise.
Right now, we have suddenly found ourselves in a world where there's lots of information, and so we're having to figure out how to ask the right questions of that information. And so I think that's a question for science, but it's also a question for bioethics.
Tackling disparities in care is an ongoing priority for the Center, especially issues like the crisis in maternal and child health. The U.S. is the only developed nation with a mortality rate that's going up, alarmingly so for women of color. This and many other issues on the vanguard of health and healthcare will be part of the Center's story going forward.
It's about visioning a different kind of world, where the dignity of human beings are respected everywhere, in all cases, in all societies, especially here at home with our patients and families.